And so welcome everybody. It is such a joy to see old friends and meet new ones, and to have you all here to share in this forum and to talk together about an incredibly important issue, which is how do we put the data together to figure out what works. This forum that we're holding, it started around the UN Sustainable Development Goals, wanting to be able to answer some of those crucial questions of what really works at a national scale. What can governments really do to move poverty, to improve health, to address educational inequalities in other areas of the Sustainable Development Goals? Obviously now we're amidst a global pandemic, recession, devastating impacts in many ways where, again, government action, what can work at national scale becomes so crucial. So I'm thrilled to be able to host this discussion about advanced research methods on it. How do we really measure what governments are doing, their actions, their policies, their laws consistently across so many diverse countries around the world? How do we measure the outcomes consistently across countries so you can really compare impact? And then how do we use advanced statistical, epidemiologic, econometric methods to understand what works? We're going to do this in 3 rounds of questions and discussion. While the speakers go around in those rounds, if you have questions during it, feel free to throw them up in the chat. I'll keep my eye on the chat and bring them back to the speakers. And then we'll all open it up for everybody to talk, comment, add ideas, and add questions at the end. So if that sounds good, I'm now going to introduce everybody moving from west to east who will be speaking. I'm Jody Hyman. I direct the World Policy Analysis Center at UCLA. It's my great joy to be here with you, and I'm also a professor in 3 schools in public health, in medicine, and in public affairs. I'm thrilled to be joined by Arijit Nandi. He's director of the McGill Institute for Health and Social Policy and holds a Canada Research Chair in the political economy of global health. With Ari, do you want to wave so people see where you are on the screen? With, thank you, welcome, with Dave Gordon, who's director of the Townsend Center for International Poverty Research and a professor of social justice at the University of Bristol. Welcome, Dave. And with Amy Robb, who's principal research analyst at the World Policy Analysis Center. Welcome, Amy. And I want to give a especially hearty welcome to everybody doing it live. My colleague who's doing the technology with me here in California. I'm in California, he's in Oregon, but here on the West Coast. Nick Perry, we're at 5 a.m. Amy Robb at the other end is at 11 p.m. So now you see why we're recording so that other people who are just living across all these time zones can see at any time. So we're gonna dive right in and start with Amy, telling us about quantitative policy data. Why bother collecting it? What is it and how do you do it?
Sure. So when we talk about quantitative policy data, what we're talking about is distilling tens of thousands of pages of legal text into quantitative measures so that you can really rapidly see in 20 seconds where the world stands on a particular policy issue. At the World Policy Analysis Center, we've created more than 2,000 quantitative measures of laws and policies across 193 countries that look at a range of topics from education to child labor, child marriage, equal opportunities at work, work-family policies, policies that matter to health, to sexual orientation and gender identity, disability, and more. And what these measures really enable us to do is to rapidly see areas where the world as a whole is just lagging in essential pieces to really fulfill the sustainable development goals, where the world is doing relatively well, but there are individual countries lagging behind. It also lets us really shine a light on where there might be structural inequalities just hidden in law that limit our ability to move everyone forward and end up leaving people behind. And it allows us to really identify where there are models and different approaches across regions and income groups that are feasible and effective for countries to do better. These legal measures really matter because while targeted programs can be immensely powerful in individuals' lives, to achieve the transformational change that we really want in the SDGs does require this action at scale. It requires changing the rules that shape individuals' lives, where they work, live, and play. And in fact, the SDG embeds these legal changes in the targets alongside outcome measures to remove gender inequality in law and create social protection programs, among other commitments. So as we create these measures, what we're really trying to do is to distill from all of that legislative text, from those thousands of pages, the decisions that really matter to the SDGs. So we're not just looking at whether they have a law in place, because we know that's not enough, but we're looking at whether that law is adequate, whether paid parental leave is enough that all workers can afford to take it and it's long enough to encourage exclusive breastfeeding, whether policies cover everyone, whether they extend to the informal economy or to self-employed workers or to people who have just started a new job, and also whether these policies are undermined by legal loopholes. Is there a law prohibiting child marriage, but then allowing marriage at younger ages with parental permission? And all of these pieces are really tremendously important from an accountability perspective. We know that if there's a law change today, we may not see what's happening in those outcomes for years to come. So by tracking what's happening on laws as well as outcomes, we can hold policymakers accountable today for what they're doing. And it also gives policymakers credit for what they're doing that's within their control to change, even if those results may not be seen for a while. So these pieces are really key for that monitoring and accountability of the SDGs, and also to accelerate progress by knowing what's feasible and effective.
Great, thank you so much. And as we go along, for those who want to see things visually, I think we can all give web links where you can do it. We'll throw them in the chat, but we'll also speak them for people who are seeing it afterwards, because I'm not sure how much of the chat they get. But to get a visual sense of what it looks like to compare quantitative indicators of policy, if you go to worldpolicycenter.org, and you can spell center, either way it gets spelled around the world. So worldpolicycenter.org, you can pick your favorite policy and start to look at it. Now, Dave, it's great to know what countries are doing. So the policy data really, as Amy has so well described, it can tell us in a lot of nuanced ways what actions countries are taking and sadly what they're failing to take, which can have enormous consequences during the pandemic. Is just one example that you'll see on worldpolicycenter.org. We map whether or not countries offer paid sick leave, so whether workers are having to choose between going to their job sick and potentially infecting others and staying home and earning the income they need. But the policies aren't enough. We have to know about the outcomes to know whether these policies are working, and it's very difficult to know how we can truly measure outcomes across countries. Dave, guide us through that.
Okay, that's a really good question and a difficult one. The most important thing and the first thing you need to do in order to measure outcomes in a comparable way across countries and also across different social groups within countries, is you need a agreed definition and some kind of theory as well. Otherwise, your measure won't have any face validity. People simply won't believe the answers, however well you do the technical bit. So, for example, if we're trying to measure poverty in a comparable way across countries, we draw upon base ideas about basic human need, the things people need everywhere in the world, but also upon human rights ideas, which have been agreed everywhere. Human rights are not just British values or African values or Asian values. They've been agreed by everyone. So there's a need to have food, there's a need to have shelter, etc. And these are universally agreed. So your measure must have a face validity. Then you must get the technical bit right. So any measure must be both valid and reliable. It must measure what it's meant to measure, and that measurement must be repeatable. If you did a separate survey, you would get a similar result. In technical terms, it must have a relatively low systematic and random error. Thirdly, when comparing between countries, you really want to make sure that the measurement, you have what's called measurement invariance, that you're measuring the same phenomena in the same way in different countries. And that can be quite tricky even technically, because these statistics were first designed for seeing if exam questions were correct for 16-year-olds, taking them in exam conditions in different countries. They're not really designed for large surveys in different countries using different methods to collect the data. But there have been a number of technical advances which allow you to check that a score of 5, say on a scale in Germany, is the same as a score of 5 in South Africa, for example. And lastly, if you're comparing across cultures or within countries across different social groups, you may need to use slightly different questions. If you're comparing poverty in Luxembourg and Burkina Faso, you would need to use slightly different questions because there's much greater poverty, much greater depth of poverty in African countries than, say, some rich European countries. So you must then be able to align your measurement scale to say how much worse things or how much better things are in country A and B. And there are a number of technical ways of doing that using item response theory and other technical methods, which we won't go into. So it is possible to do. You need a agreed definition, you need to do the technical work, get a reliable and valid measure, and you then need to check that the measure is the same across countries, and you then need to align any scales you may create so you can see how you might make an exact comparable measure across countries.
Thank you so much. And if there are URLs now or later that you want to send people to, just let us, for more information on what you're saying, just let us know, and Erin will type them into the chat for everybody.
Okay, so there's a clear example across the European Union with developing new measures of deprivation for all people and for children, which had to pass through, be approved by 40 different legislatures in 28 countries. And some of the methodologies have now been accepted by the UNECE, Economic Commission for Europe, and been reported and accepted by the United Nations, and I can send links to those reports which give the technical details.
Fantastic, fantastic. And for everybody who's with us, as before I transition to Ari, so this first round, we're having 3 rounds of questions. This first round, you're going to hear about general approaches, because these are what help us at every time, whether it's amidst the pandemic, whether it's the long-term project of working on the Sustainable Development Goals, or whether it's other long-term initiatives. How do we get education advanced and more equal in all countries? How do we improve labor conditions across all countries? in the second round that we go around, we're going to focus on specific examples of studies that have been done on issues that help towards the Sustainable Development Goals. And in the third round, we're going to talk about how different is data, though? What are the challenges when you're in this dramatically, rapidly changing world? So we've heard from Amy about how we can look at policies across countries. We've heard from Dave about how we can look at outcomes across countries. The goal of having more than one country is really to have comparison groups, because that's the only way we can begin to rigorously understand what works. But the process of rigorously analyzing what works is complex and difficult. So we're really looking forward to hearing from you, Ari, about how we do that.
Sure, thanks, Jody, and thanks for organizing this session. So in terms of studying impact, I'd say at its core, it's really about experimentation. So in the biological sciences, many of you might come from this background. We might think of all kinds of different experiments where we, as the experimenters, change just one thing and try to evaluate the effect of that intervention, right? So this is commonly seen in mice experiments, for example, where we might knock out a particular gene and try to measure that the impact that this has on, say, the production of a particular protein or the animal's behavior. And I would say that when it comes to public policy, we are essentially the mice, and the policymakers or programmers, whether it's governments or NGOs or private institutions, are basically the experimenters. And this is a social science sort of experiment that we live in. The COVID pandemic, which we're going to talk about later, I think is a perfect example of this. I can't think of a 6-month period in my lifetime where we've seen more rapid public policy change. And it's clear that the public health, economic, and social interventions that we've seen are the primary means that we have to counter this virus. So when it comes to measuring impact, I think the first part is really trying to specify what we call a what if question. These are, you're probably familiar with the term, counterfactual questions about what the world looks like in terms of potential outcomes of interest under different policy scenarios. So for example, what's the impact on rates of gun violence if we required stricter background checks on gun purchases? What's the impact on rates of neonatal mortality if we remove user fees from maternal health care, including childbirth in a health facility? What's the impact on food security, right, and well-being if we provide income support to folks who can no longer work during the COVID pandemic? And I'd say that we have different tools to study impact. On the one hand, we have traditional experiments, which are prospective in nature, so looking forward. In this case, we might have a program that we want to evaluate, and we can think of randomizing different program conditions to individuals or to communities. And this has been the model of places like JPAL, which was awarded a Nobel Prize for the different types of social policy experiments that they've been doing for many years now. But on the other hand, I'd say that many policies can't be randomized for a variety of reasons. These can be practical reasons. Often these are large-scale programs, which are policies which are implemented at the national scale. And in many cases, the political will for randomizing policies or the ethical basis for doing that don't really stand their ground. So in that case, how do we evaluate impact? Well, we can look back at what's happened historically using the type of policy data that Amy was talking about. If we've got information for that particular population of interest on the policies as well as the outcomes that Dave introduced. And I would say when it comes to the evaluation of historical policy reforms, we can think about these what if scenarios. We can often measure what happened with a particular municipality, whether it's a country or state or province, that may have reformed a particular policy. So we need to ask ourselves questions. What would have happened had this particular country, for example, not reformed this policy? And for this, we have to compare outcomes in the country. We could think about comparing outcomes in the country before and after, which would include standard pre-post and perhaps more sophisticated interrupted time series sorts of designs. But we could also think about comparing post-intervention outcomes for that country that reformed the policy, say comparing it in that treated country, quote unquote, to some control country that didn't implement the policy. So those are basic observational studies, or we could do both, right? We could think about comparing outcomes before and after in the affected country versus some control country or countries that didn't implement the policy. And that includes types of quasi-experimental designs like difference in differences, synthetic controls, and let's say interrupted time series with a comparison group. So we have all of these different types of tools at our disposal, all of which rely on the type of data that Amy and Dave mentioned, right? Both policy data collected systematically across countries that allows us to identify reforms that have occurred and when they've occurred and specifically what they've affected, and also the standardized or harmonized outcomes data that allows us to compare outcomes in a standardized way, in a similar way across countries and over time. And once we have that, we can think about designs, right? So whether it's the types of designs where we're using an internal control, so basically just extrapolating out time trends like we would with ITS, interrupted time series, or collecting information from some control group, right? Whether it's a different country or state or combination of those. It's really kind of designing or tailoring a design to each particular question and based on the data that's available. And each of these has its strengths and weaknesses that have to be considered as well. So I think I'll end there.
Thank you so much, Ari. And I'm gonna bring it back to you in a specific example. And as I do, if there are examples that you want to highlight on Prospered or other websites, do let everybody know. If you speak the web address, Erin will put it in if you want to send anyone to any URLs to learn more. So this has been really helpful, Amy, Dave, and Ari, about how we generally approach it, but I think everybody who's listening will get a much deeper sense if we can walk through some examples and what some of the challenges are in those examples. So, Ari, I know you've led some of the seminal work on the impact of paid maternity leave on infant outcomes, and this work has been picked up by policymakers around the world to move change. So walk us through some of that work and the decisions you had to make, why you took the approach you took to it, so that we can have a better understanding of what's a critical question that can be answered and how do you get all the way to an answer that a legislator, a head of a health department or a labor department or advocacy groups can use to make change happen in people's lives.
Sure, my pleasure. So yes, for the analysis of paid maternity leaves, we use the types of data that Amy and Dave introduced. So we identified reforms using the quantitative policy data that was collected by UCLA and McGill, and which is publicly available. So those of you who are interested should really go check it out. To identify changes. So for, in the context of paid maternity leave, we looked at a couple of specific changes, though there are many that you could look at in this data set. So we looked specifically at changes with respect to the duration of leave that was provided to new mothers, and also with respect to the wage replacement rate. So the proportion of your income that you would be receiving during your period of leave. And from this, we can do a comparison of countries over time, and we can see which countries have changed their laws on maternity leave, in our case, starting around 1995. So we had basically a 20-year retrospective assessment of the policy changes that have occurred with respect to these specific policies or interventions. What we then did is use the type of data that Dave mentioned. So we went specifically to the DHS, and for the countries that we had policy information on, which, well, in this case was basically all countries, we looked at whether we could measure outcomes of interest, right? Things that might be plausibly affected by reforms or increases in the generosity of maternity leave policies, for which evidence is really lacking. For which of those outcomes can we measure things consistently in the period from about 1995 onwards? And since the DHS are serial cross-sectional surveys, meaning that they're conducted repeatedly, oftentimes in the same countries on a standard frequency, so every 3, 4, 5 years in many cases. What we can do is we can take the birth records that are collected as part of the DHS, right, which gives information on many different types of characteristics, including measurement of neonatal and infant mortality, but also things related to child vaccination, child nutrition, and also health outcomes, including things like the incidence of severe diarrhea. So these are all the different types of outcomes that we thought might be plausibly affected by increases in the duration of paid maternity leave. So in this case, like I said, once you've got your question, you've got your data, you have to think about design. And what we've done in I think just about all of these studies where we've looked at trying to evaluate the impact of paid maternity leave reforms is use a difference in differences design. So going back to my earlier remarks, what this basically does is it compares outcome trends. So say in the probability of infant mortality in the paper that Jody referenced, before and after, right, in countries that increase the duration or change their wage replacement rate for their maternity leave policies, to the corresponding trends over the same period for a set of control countries, right, that did not change their policies. And the key assumption for this type of design is what we call parallel trends. So does the change observed in the control countries represent what would have happened in the treated countries had they not reformed their maternity leave policies, right? So they basically have to substitute for what would have happened in these countries that enacted reforms had they not. And there's different ways that you can try to assess whether that is a valid assumption. So they're kind of empirical ways for looking at this, of course. So in the case of neonatal and infant mortality, we found that each additional month of paid maternity leave led to reductions in mortality. For infant mortality, it was roughly 8 fewer infant deaths per 1,000 live births. So it was about a 13% relative reduction. And like I've said in other subsequent studies, some led by colleagues at UCLA, we've looked at other outcomes as well, including the incidence of severe diarrhea. We've looked at nutritional outcomes as well. So I'll wrap up, but just to get quickly to Jody's second part of the question about the reasons for studying impact, and I think kind of why this is relevant to policymakers. I'd say ultimately, if we want to get from point A to point B, where point A is kind of the starting point and point B might be some goal that we have for our society. So these might be like an SDG type of target. There's many different routes to get there, right? Just like when we're traveling. And I think these routes can represent different policy alternatives. So in many cases, we don't know which route is most efficient when we're starting off on our trip. And for that, we need evidence, right? So through impact evaluation, I think we can learn about which routes work and which ones don't. But I also think it's much more complicated than that. The routes may have different costs associated with them in terms of, well, I'm here in Montreal, so running into construction, as I alluded to before. Perhaps some combination of routes might be most efficient, so some combination of policies. Some routes might work better for other people, some people versus others. So there's equity considerations here as well. And of course, there could be unintended consequences of taking one route over another route. So I think we have to be cognizant of the fact that, a particular policy reform may have many different effects based on the outcomes that you look at, whether they're health outcomes or social outcomes or economic outcomes, and those things have to be weighed. But ultimately, if we don't have the answers to some of these questions, it's very hard to make informed decisions. And I think that's why we study policy impact. Thanks.
Thank you so much, Ari. And I want to, it's kind of like an epilogue that I want to give, but it's also, to Ari's point, more like a in-between log, because we know this journey will continue forward. But the study that Ari led was picked up by senators in the Philippines who were advocating for paid maternity leave. It was then used by them in arguments that helped lead to a nearly doubling of paid maternity leave there. So they combined the maps that Amy had described, which talked about where the Philippines was on a global scale. It had good leave, but not as good as other reasonable comparators. And Ari's study allowed them to see the benefits. There were deep civil society and policymaker work for a long time, undoubtedly in the country, moving these issues. But I think that shows the synergy. And part of the reason I wanted to raise it was not only to give a shout out to the senators in the Philippines and to Ari for his research, but for everybody who's listening to say, this actually wasn't a direct contact. This was because the research hit the media and reached people. So we're doing this on Zoom now, it's recording, we're getting it across time zones. But for people who are doing their research in regions around the world now, in countries around the world, at universities, at UN agencies, at think tanks, who are listening to this, who are at early career stages, or who are feeling that maybe how do you get your research out? I wanted to raise the example to say that is one of the extraordinary things that has happened in terms of the transformation in technology, is how feasible it is to get the research out to wide audiences, to hear from each other, and to learn from each other when things work and don't. The one other thing I want to highlight about the importance of that study was, to Ari's last point about what works where, there had been previous studies about maternity leave in high-income countries, but that didn't mean it would work across settings. The question is, could we then start looking in very different economic conditions to see if it made a difference? So that's going to turn me to Dave. And Dave, I think you're an expert in one of the most difficult areas, which is how do we measure poverty comparably across vastly different economies? So walk us through some of the details about how you conceptualize it and how you do that work in such a crucial area.
Well, from the point of view of the policy, what politicians and what the public are interested in are the outcomes of the policies which are designed to reduce and ameliorate the terrible consequences of poverty. And in order to measure the consequences, we tend to draw on Peter Townsend's relative deprivation theory of poverty, because it's one of the few theories which is, at least theoretically, applicable to all societies at all points in history. And this argues that poverty is a lack of resources, a lack of income, and the outcomes of poverty are deprivation. You become deprived relative to the normal situation in your society. You can't do the things that most people take for granted, and you don't have the things that that you would expect and other people would expect you to be able to have in your society. You're basically excluded from full participation as a citizen in your society or in your group, because you simply don't have the money and other resources in order to participate fully the way you'd want to do so. So it's not just material things that are important. Obviously, you need to be able to have enough food, adequate food for your society and the type of food you'd expect to have in your society, shelter, clothing, all those kinds of basic material needs to be met. but you also, very importantly, social needs, and these are often missed in measurements of poverty and policies that look at the outcomes of poverty. They often look at the material consequences, but not necessarily the social consequences. So in all societies everywhere in the world, there are certain social norms which we need to meet as human beings. All societies, you're required to give presents at certain times of year. You're required to honour your children's wedding, or all kinds of rituals at birth, death, coming of age. And these social obligations that you have as parents, as children, as siblings, as friends, are extremely important. And people will go to extraordinary lengths to meet those obligations. And if they can't meet their obligations because of poverty, that often has a huge detrimental impacts on their mental health and also on their physical well-being. So we look at both material and social outcomes of poverty in terms of deprivation measures, and we measure the effectiveness of policies designed to alleviate poverty in terms of whether they improve people's lives, in terms of what they have, but also in terms of what they can do.
Thank you so much. Amy, I'm going to both ask you two questions at once and invite everyone to start putting any questions they have in the chat as we start to apply it to the current circumstances. So the first question, Amy, that I want to ask you, which is broadly applicable pre-COVID, it has to do every time we're addressing these problems long-term, is how do you keep policy data up to date? And I think that's so crucial if we're using it to monitor change and hold accountability. So talk to us about that process. And then when you're done talking about how we always do it, tell us what it's like as we head into things like the pandemic. Can existing policy data help us at all? If so, how? Or do we need new data, and what do we do about that?
Sure. So in terms of keeping policy data up to date, the hardest work is really building it for the first time. So when we're building it for the first time, we have to build a framework. We have to figure out what matters, both based on international agreement and research evidence of what the important pieces are. We have to reach out to key stakeholders to make sure that the questions we're asking address the questions policymakers need answered, as well as the issues that civil society really care about. And then we have to test that framework with a range of countries to make sure that the way we're coding it really reflects the diverse approaches. Then if it's the first time around, we also have to read legislation for all 193 countries. To keep our data quality high, we use a double coding process. So we have an international multilingual interdisciplinary team for each country. 2 analysts read legislation in full and answer questions from the framework for it. And then they reconcile their answers. This is to minimize human error, and also because legal frameworks are really complex. And it may be over the course of doing those 193 countries that we also find new approaches that we didn't notice in the first 20 and need to adjust it more. So it's a really intense, evolving process the first time we build data. But an update to keep the data current, to keep it relevant, to be able to answer how countries are improving or whether they're stagnating is a much lighter lift, because it may be that only 10 or 20 countries changed their policies between the last time we coded it. So instead of reading legislation across 193 countries, we're reading legislation across a much smaller set. So that's a lot easier for us to be able to do. In terms of data amidst the pandemic, the focus of the policy data we've been creating is really on laws that form the foundation for better health, for economic security, and for equal opportunities. And so a lot of our data really speaks to the pandemic. Jody mentioned paid sick leave earlier. It's really at the core of being able to respond to a pandemic at the intersection of health, disease spread, and economic security. So with that data, we were able to really rapidly understand where countries had no paid leave at all. So they had no way to really help workers stay home when they were sick. Where for a quarter of countries, they did guarantee paid leave, but it wasn't from the first day. So that meant with minor symptoms, people might decide to go into work because it wasn't that serious, which of course would accelerate disease spread. And we indeed saw that many of the countries that struggled at the start of the first wave didn't have paid leave on the first day of illness. It also helps us to identify other gaps that really matter in the pandemic, whether insecure work, vulnerable workers, workers in the informal economy had access to paid sick leave. And of course, those are the ones who need it the most, who can afford to stay home when sick the least. When we think about other challenges in the pandemic, certainly work and caregiving is central among them, and data we've collected on prohibitions of discrimination at work has enabled us to see that nearly 2/3 of countries don't prohibit discrimination at work based on caregiving status explicitly in their laws. So during a time of economic insecurity, we have to be really concerned that working parents don't have protection from terminations because of those caregiving responsibilities, and they don't have protections if they'll have equal opportunities when searching for a new job. Another long-term piece that we can think about is investments in education. With the economic downturn, families' ability to send their children to school is sometimes a tougher decision, with tuition barriers, with child marriage rates threatening to increase. At the same time, country resources have really been pushed to the brink, and so investment decisions by policymakers are a lot harder. So we need this policy data to keep accountability for what countries are doing for these long-term investments in children's futures, as well as for showing what's feasible and that these investments really matter.
Thank you. Thank you. The sick leave piece that Amy mentioned in a series of resources, from maps to policy briefs to the downloadable comparative sick leave policy, I've given a link to all the launch in the chat for that. Shoylin has asked whether we're working on laws against corporal punishment for children. I wish the answer was yes, and the answer is not yet. We think it is a very important area. When people go to the World Policy Center website, you'll see that we've done work across education, labor, child marriage, areas that do have to do with the physical safety, well-being, and development of children, among many others. We have sought funding for violence against children, including both from known people and others, but we have not yet gotten the funding to do that work. There's also, Erin has posted other data out of the pandemic where we look at guaranteeing equality at work and non-discrimination at work. That's so crucial at a time when there's massive job loss. The opportunity for discrimination and who loses jobs and gets jobs back is enormous. That's another example, I think, of a long-term commitment. SDG 5, gender equality, SDG 10, equality across dimensions, the Universal Declaration of Human Rights, CEDAW, CRPD agreement, ICESCR agreement after agreement, that we need equality. But how do we actually hold countries accountable? We have to start measuring their laws, that people really have equal rights and that they're implemented. Now, the process of measuring their laws brings me to a question in the chat from Precious about how do we code the data. And Amy, could you please explain a little better the double coding process? So for those who are at a stage in their career, whether it's because they're grad students or a postgraduate student, or whether it's because they've been doing this for decades, but they want to take on new work, what does double coding really mean and how do you do it? If you can give us some insights in that, then I'm going to go to Dave and Ari around the pandemic.
Sure. So once we've developed a coding framework, that's a series of close-ended questions that allow people to answer basic features of the policy. How long is paid maternity leave? What is the wage replacement rate? What is the tenure requirement to be eligible for it? Just a whole range of questions. We have a systematic code book that has the question, valid response choices, as well as instructions for how to code. And then each analyst reads the legislation in full and they answer each of those questions in a database. Once they're done, they meet together and they just compare their answer for every single question, and they watch as they enter it into a final clean database to make sure there aren't any misclicks or mistakes along the way. Often when they're doing that, complex cases come up, things that the coding manual isn't really explicit about, or things where people could reasonably have pretty different interpretation. So when that happens, we meet as a team to discuss those decisions, to see whether we think it really fits in some way in our existing framework, and if so, what that approach should be, or whether we don't have a good way to capture what those countries are doing. And in that case, we'll often, if it's an important enough piece to capture, go back and revise the framework so that we're capturing that approach as well. So it's really an iterative, very time-intensive process to try and ensure that these are as accurate and comparable as possible.
And just to provide further detail on that, I'll mention that we'll be teaching a course at UCLA where we will be going through the coding method over a series of sessions. And I'll ask the students if it's okay with them if we record it. As long as they say it's fine, then we'll put it online. We would also invite people to join us by Zoom, but it is 3:30 to 5 in the West Coast in the afternoon as opposed to the morning. So it's not the most friendly time for elsewhere. So we'll try to get that up online. Now, Ari and Dave, the pandemic. So the two questions for you both to have a shot at are, for Dave, the survey data takes years to be developed. Is there data we can get quickly as conditions are changing day by day, week by week, that's worthwhile outcome data? And for Ari, does this change how we think about new methods that would give us real-time answers in the pandemic? But also, do some of the answers we already have, can we apply any of those impact studies, or in new circumstances, is it just too difficult to apply? And I'll let you both take it in whichever order you'd like.
Okay, but, if you don't mind, Ari, I'll start. We know from the history of pandemics that they have certain impacts. They will differentially impact on those who are most vulnerable at the bottom of society, and they'll lead to both short and long-term increases in inequality. So you can target certain groups that you know are more likely to be impacted using modern rapid survey methods. As we've learned more about this virus, we know in particular its health outcomes are very cruel, It differentially harms older people, those who are sick with certain pre-existing conditions like diabetes or high blood pressure. At least in the first wave, those who are poor, like every other pandemic, those people who are obese, and people who are ignorant and therefore can't follow the public health messages. We know from existing survey data there are certain groups of people, particularly in poorer countries of the world, who are much more likely to have difficulty in following the public health messages. At the moment, there's no effective treatment or cure for the coronavirus, COVID-19 illness. So all we can do to ameliorate the impact is to follow the public health guidance of social isolation and hand washing and social distancing. If you need to leave your home every day in order to collect water or to go to the toilet because you don't have a toilet in your home, or to collect firewood to cook, or to use because you need to buy food every day, then you're going to be in much more social contact. Again, if your home is overcrowded and there are a lot of people in your home, or if there are older people living with a lot of younger people, or people who we know are vulnerable to the virus living with a lot of younger people, then we know that those groups of households are much more likely to need help with social isolation and meeting the public health measures to protect themselves. So many households will need food, but also many households just don't have even soap or water in which to wash their hands. So where governments are providing support through food distribution or through social security measures to allow people to have the money they need to buy food, they may also need to provide soap. They also, of course, crucially need to get them public health messages across to the population. And large numbers of people across the world, unfortunately, have no source of public information. They don't have radios or televisions, and therefore you need people on the ground who are trusted to give these health messages. So we know where the people are who need help in order to comply with the public health information that's available, which will protect them, and that can be really helpful in governments implementing protective methods. And many countries in the world have managed to suppress the virus. It's not just countries like Luxembourg or New Zealand, but countries like Togo, Rwanda, Uganda, Laos, countries you wouldn't necessarily expect as being top of the list, have been prepared for this kind of epidemic, and they're really successfully in stopping it in its tracks.
So thank you, Dave. Dave's given us a good example of where pre-existing data, and on their website you can find some of this really important mapping, gives us insights to, is it realistic to expect people not to be in crowded circumstances? Maybe not, depending on their housing. Is it realistic to think about hand washing as a solution if somebody doesn't have access to water? So what the baseline data has. There still remains a huge challenge, which is what is real-time data. In some countries where there's phone penetration, we can get some of the data that way, but that doesn't work for the poorest, most marginalized populations. There, we're really often left with what can past lessons do to help us in the pandemic. So I want to turn, Ari, to you for final thoughts on how do these past studies or future studies prepare us for future emergencies? How do studies in non-emergent times prepare us for emergencies? And anything you want to share about methods that might be unique to the present time, coming full circle to where you began it around there are some natural experiments.
Thanks. Those are some tough questions to answer, so I'll try my best in my closing section here. So I think not going out on a limb by saying that I think it's the public health and social policy responses that have really kept society from basically falling off of a cliff during the COVID crisis, right? So, you know, when it comes to COVID's effects on society, I think we're aware of many of the problems that it's created. Dave and Amy mentioned many of these, but, you know, people being out of work and of course not earning any income, the impacts, of course, on mental health and well-being related to social isolation, children being out of school, not learning, older folks not receiving the care that they need, and the lack of social support that they need. So I think the problems are very clear. I think the challenge is what are some of the solutions that we have, some of the instruments that we've got in terms of policy. I would say in some cases we can draw on available evidence from non-pandemic years to inform these policy responses. So, you know, we have a lot of evidence, for example, on income support and poverty programs to help folks who can't work for medical or other reasons. Dave mentioned some of these, but Dave and Shailin and Jody are really the experts on these types of this type of evidence. You know, just speaking of Canada, where I'm based, you know, we have the employment insurance program, right, to assist workers who can't work for reasons related to illness. And the government has made changes in this program to make it more easily accessible, more eligible, and more relevant to the COVID crisis. So I think these small tweaks and adaptations can probably have a very large impact. And I think there's also a lot of public health evidence that's going to be very relevant. So, you know, how do we convey accurate information to influence behavior change and encourage the public to respect social distancing and other protective measures, such as wearing masks? If you had asked me before the pandemic if this would be a problem, I'd probably say, no, I don't think it's going to be a huge problem, but it's turned out to be one in many different contexts for a variety of reasons. You know, again, going to public health, what do we know about issues related to vaccine hesitancy? I think another problem that we're seeing on the horizon, once the vaccine is hopefully developed, which is hopefully soon, can we actually convince people that it's safe and effective for them to take it? And I think there's a lot of evidence growing that a substantial proportion of the population is hesitant to do that, which of course will affect our recovery as a society from the pandemic. So, you know, whether all of this evidence, whether it's public health or kind of based on social programs, can be generalized from non-pandemic times to pandemic times, I think is a challenging question to answer. But I think it's the best evidence that we've got. It's of course only one ingredient in this process. So this could explain why we see such different policy responses being taken by different countries. So some, for example, have given stimulus or income support directly to workers. Others have focused on giving support to employers to keep people on payroll and keep those businesses open even during the layoff. So these are very different approaches that might have very different consequences down the line. When it comes to the evaluation of the measures that are being taken now, I think this is going to be a very hard nut to crack. You know, briefly from a policy standpoint, COVID, as I said, basically changed everything everywhere all at once, right? So, you know, this makes it very hard to identify control groups, as I mentioned in the example of maternity leave policies, right? We can't find areas that were unaffected that look like areas that enacted policies, you know, but didn't, right? Every society was affected by COVID. Every society enacted different measures. How do we find a reasonable counterfactual? I think is a very challenging question. And I think another issue is that, you know, the changes themselves were implemented in response to the outcomes that we're interested in studying. And so this raises concerns about reverse causation. On a more hopeful note, I think where I'm seeing more and more potential in terms of evaluation is in terms of, I guess, what people generally call implementation science. So, you know, we've seen a lot of inefficiencies in terms of the delivery of social programs. There's many different anecdotes about this. I think, not picking on LA, but I think the LA Lakers were getting money from the US government to get them through the COVID crisis. They don't seem like they need the money, probably. And I think there's stories in Canada of many people having to return the income support that they were getting because they actually, in fact, were not eligible. So how do we actually deliver social programs so that they get to those who need them in the times when they need them? I think is an interesting question that this crisis provides us a lot of opportunity to understand. And when faced with new challenges in the future, hopefully no time soon, hopefully we can say more about how to get from point A to point B in the most efficient way based on this evidence. So I'll end there.
Thank you so much. So a really powerful description of how strong baseline social policies, social protection, strong baseline health, as Canada already had, and then improving that, adapting to the situation, can lead to success stories in countries. Not surprising, we heard that note of optimism from Ari sitting in Canada. I know I could read the faces of some of our others, participants and guests who are in countries that have had less effective responses, sometimes because there were little social protection in place or it was already being eroded. So the baseline matters, and how we address it afterwards matters. Ari has given a really good example of the kind of implementation studies we can do. I do want to mention two kinds of policy studies we can do also. One way that some people are right now studying the impact of policy choices is taking that variation in baseline when a country levels up across states or provinces by new policy. So there are some natural experiments that are happening and some counterfactuals that exist, even though they're imperfect in the ways that Harry mentioned. So we'll close in a minute, but I know that there may be some burning questions that didn't make it into chat. So if anybody has a burning question that they want to either unmute themselves and ask personally, or that they want to throw in the chat, I want to make sure to give a moment to do that before thanking the speakers. Here it comes. Okay, and more resources in the chat. And Dave has listed some of the countries that actually did achieve suppression of this time of the virus, not of the populace, a really dangerous consequence of some of the responses. I just want to really thank everybody for joining us. I know, we're going from before 5 a.m. when we start on the West Coast to after midnight in the Pacific. I want to thank everybody in between, even when it was in the middle of your day. And especially heartfelt thanks, because we need everyone to work on trying to understand what works. These are challenging problems. These are not easy problems. How do we have colleagues, students, researchers trying to look at the variation of policies to reduce the spread of pandemic while respecting civil rights and civil liberties. What works? How do you reduce the spread while keeping economies thriving, or at least having the ability to bounce back? And then outside the pandemic, how do we really transform the course we're on? Even before the pandemic, maybe the inequalities in health were less visible to some, but they were no less visible to everybody who was living them. So we really look forward to the opportunity to learn from all of you and to work with many of you in the future in trying to address these together. And deep thanks to Amy Robb, Dave Gordon, and Arijit Nandi for leading us through this discussion, and to all of you for joining us. Stay healthy, be well.
Thanks.
Okay. Thank you. Bye.